Misunderstanding 1. Wearing a face mask will protect you from getting infected. Since the first outbreaks began in the United States, the use of face masks by the general public has been a highly debated and deeply confusing topic. After initially claiming that only medical professionals needed to wear face masks, the Centers for Disease Control and Prevention (CDC) issued an about-face and updated its stance, advising everyone to wear cloth face coverings in public settings where other social distancing measures are difficult to maintain, such as in grocery stores or pharmacies. Wearing cloth face coverings is especially important in coronavirus hotspots, says the CDC. But the purpose of masks isn't to prevent healthy people from becoming infected with the coronavirus. The main benefit of cloth face coverings for the general public is to prevent people who are already infected from spreading the coronavirus through respiratory droplets from the nose and mouth. Clean your hands with soap and water or an alcohol-based sanitizer before and after putting on the mask. Make sure the mask fits snugly. Facial hair can interfere with this. Avoid touching the mask while wearing it, even though it may be uncomfortable. Misunderstanding 2. The virus was created in a lab, with 5G tech spreading it. As the virus speeds around the globe, conspiracy theories about its origins have followed. About 3 in 10 Americans believe COVID-19 was created by humans in a lab, according to a Pew Research Center poll published April 8. Coronaviruses are a large family of viruses that are common in many different species, including camels, cattle, cats, and bats, according to the CDC. The SARS-CoV-2 virus is a beta coronavirus, like MERS-CoV, the virus responsible for the disease MERS, and SARS-CoV, the virus behind the disease SARS. And all 3 of these viruses have their origins in bats. Misunderstanding 3. Products imported from China can infect you. The coronavirus's origins in Wuhan, China, have given rise to the misconception that Chinese imports can carry the virus. Although the virus can survive for a short period on some surfaces, it's unlikely to be spread from products or packaging shipped over a period of days or weeks at ambient temperatures, according to the CDC. Currently, there is no evidence to support transmission of COVID-19 from imported goods, and there have not been any cases of the disease in the United States associated with imported goods. Misunderstanding 4. If you can hold your breath for 10 seconds, you don't have coronavirus. According to the WHO, this statement is false. You cannot confirm that you have coronavirus with this breathing exercise, which can even be potentially dangerous. Information about the symptoms of COVID-19 has changed since the outbreak first started, but the most common indications of infection are dry cough, tiredness, and fever. If you think you have been exposed to the coronavirus and develop symptoms, the best thing to do is call your healthcare provider, says the CDC, which also offers a coronavirus self-checker. Misunderstanding 5. Ibuprofen can make coronavirus symptoms worse. In mid-March, the French Minister of Health tweeted that people infected with the novel coronavirus should refrain from using ibuprofen, Advil, Motrin, or aspirin to treat symptoms, out of fear of worsening the illness, according to NPR. But according to the WHO, there is currently no evidence to support that claim. Misunderstanding 6. Once you recover from COVID-19, you can't get it again. While scientists don't have definitive answers, one thing is certain. People need to develop immune memory to remain healthy. At the moment, it looks like the majority of people who've had COVID-19 are unlikely to get it again in the short term, but we don't know that for 100% certain because we haven't done the study to see re-challenges to see if they're all protected, said Fauci on The Daily Show. To better understand reinfection risk and population immunity, the FDA granted emergency authorization to Mount Sinai Laboratory in New York City to identify antibodies against the virus, according to UpToDate's literature review of COVID-19, last updated April 17, 2020. Misunderstanding 7. You can do your own medication. Extreme measures like ingesting sodium chlorite products, a type of bleach, or self-medicating with fish tank cleaner will not help prevent or treat COVID-19 and can be dangerous. Smoking and taking herbal remedies or antibiotics are also ineffective against the coronavirus, according to the WHO. Misunderstanding 8. Young people can't get the coronavirus. While the risk of serious complications and death is higher in older age groups, younger people are becoming infected with coronavirus and getting sick. A preliminary report released March 18 by the CDC suggested that while most Americans who develop serious complications from COVID-19 are age 45 and older, a sizable proportion are young adults. About 38% of individuals hospitalized because of the virus are between 20 and 54 years old, according to the study. Misunderstanding 9, the virus will go away when the weather warms up. The flu, another viral illness, hits its peak between December and February, leading some people to assert that COVID-19 will also miraculously go away in the warmer months. Health experts are careful to say that any decreases will likely be minimal. Misunderstanding 10, social media is a reliable resource for updates on the pandemic, at a time when what experts believe to be true seems to change nearly every day. It's important to know which sources to trust. 4 ways to spread misinformation. Intentional disinformation, telling people to do something that is potentially harmful, such as drinking bleach as a COVID-19 cure. Satirical misinformation, making a joke, such as recommending Corona beer as a cure for the coronavirus. Ignorant misinformation, sharing what seems like a good piece of medical advice but that turns out to be inaccurate. Anecdotal disinformation, sharing personal stories that are logically flawed and targeted at specific groups. Thanks to our healthcare workers. Remember to wear your mask. Wash your hands regularly with warm water and soap. Please practice social distancing. Please like, share, and subscribe to my channel. Thanks for watching. Stay safe.